my name is Brittany Kowalczyk, and I wanted to discuss with you my presentation on CODIs. So, catheter-associated urinary tract infections. One of the things we need to know is CODI prevention is adamant in order to assist the decreasing in the number of hospital-acquired infections. Education, taught to all new nurses during orientation, nursing students performing care, and annual education during hands-on skills is a way to reduce the number of urinary tract infections. When new nurses are coming in, they are required to go through a week's worth of orientation, which discusses hospital policies, things that they might see on the floor, presentations by different departments such as wound care or rapid response. I think this would be a great opportunity in order to add a presentation about catheter-associated urinary tract infections, which is something that we face in the hospital on a regular basis. Another thing is nursing students performing care. So a lot of hospitals are teaching hospitals, and we have nursing students on the floor, and based on what point of the program that they're in, they are actually allowed to perform care on patients that have Foley's, removal, insertion, different things along those lines. So they should also be educated on the proper information about interventions and sterile care when inserting Foley's. And then annual education and hands-on skills. Yearly, nurses are required to go to a class and perform different hands-on skills in order to keep up with their education, if things have changed, and then to make sure that they're still performing the skills properly. This would be a good opportunity for the nurses that have been on the floor for a while or have been on the floor for 20 plus years to get the opportunity to see whether or not they're performing proper care or whether they know exactly what the protocols are. As far as the cost of CODIs, that's something that I think all nurses should be aware of. Understanding how much money it costs the hospital from one urinary tract infection caused by a catheter and how it can actually affect you, your budget, if you want new supplies, if you're wanting raises, those type of things might be a little bit more of an incentive for a nurse to slow down and perform proper protocols. I also think that nurses should be educated on the number of CODIs that happen on their unit per month as well as other units to see and actually to debate whether is it a floor problem for specific nurses on why one floor might have 6 in a month and another might have 0. And then interventions to reduce CODI, I think that this should be available on the floor in documentation as well as electronically for the nurses to pull up and look at if for any reason they're questioning what the protocol is. Interventions. So some interventions that I want everybody to be aware of is one called IAMS, which is identifying, assessing, implementing, modifying, maintaining, and spreading the surveillance. So basically, you need to follow proper documentation, reasons for placement, catheter duration, adherence to closed drainage bag, proper use of sterile gloves, hand washing, secured catheters, perineal care, and breaking of the closed drain systems. Nurses need to be aware about DCAF protocols, insertion protocols, what patients actually meet the standards to have a Foley, and what patients now meet the standards for the Foley to be removed, ways that we can actually prevent infection while the Foley is in place, such as perineal care, breaking sterile technique when it comes to the insertion, and removal of Foley's is super important as well. So this is just basically a screenshot of some learning objectives that I want to present. Basically after the presentation, I would expect that the nursing students as well as the nurses would be able to describe the statistics related to the number of CODIs and list prevention strategies of CODIs, basically the death rate, cost of CODIs, percentage of CODIs in hospitalized patients. After watching the videotape, I would like the nurses to be able to describe at least 3 interventions, things like documented guidelines, continuous maintenance, or insertion or removal of Foley. And then also after the presentation, I would expect the nurses to be able to compare the guideline recommendations with evidence-based practice. So another teaching mechanism that we can use for the nurses is quizzing. What do you know? So for instance, a couple of different quiz questions you could ask in regards to caries is the percentage of CAUTI infections is 75% according to the CDC. Is that true or false? What are the symptoms of catheter-acquired urinary tract infections, which is a select all apply? Elderly patients are at a high risk of developing caries. That's a true or false. What are ways to assist in preventing caries? That's a select all apply. And what are common treatments used to treat caries, which is a select all apply? This quiz can actually be provided to all of the staff prior to them doing the hands-on skills course, as well as the online video, to kind of see what they know and where they're at. So this is just some screenshots of the pamphlet. I would expect all nurses, nursing students, nursing staff to be able to have access to a pamphlet such as this, which provides educational information on caries, things that we might not know, CAUTI prevention, where the information is coming from, different percentages based on caries, such as between 15 to 25% of hospitalized patients receive urinary catheters during their hospital stay. Also, the validity and reliability, implementation, and the reflection. Thank you.